So thank you for staying with us. Now, in recent times, there's been an increase in reports of medical negligence in Nigeria. Principally, this is attributed to a lack of sufficient medical practitioners and maybe infrastructure in the health sector. But despite the alarming number of victims, there's been a low level of formal complaints or even lawsuits for compensation due to ignorance, maybe poverty, and in some cases, reluctance to seek redress against the offending medical practitioner.
That's what we were talking about earlier, about the leave it to God
Yes.
syndromes. So in other countries, the quality of medical practice and care for patients is higher, where there is a sense of accountability required for medical practitioners. As such, it will be useful to consider the legal position in Nigeria concerning the actions for negligence against medical practitioners in the discharge of their duties. Now, joining us to discuss this is Dr. Goke Akinrogunde. He's the chairman for the Nigeria Medical Association Lagos Committee on Medical Negligence. Good morning, sir.
Good morning, doctor.
Good morning, and thank you for having me.
Thank you for joining us.
A correction, the name is Akinrogunde.
Pardon?
Not Akinrogunde.
Please, can you say it again?
Akinrogunde.
Oh, Akinrogunde. I apologize.
Akinrogunde.
Akinrogunde. I apologize for
Okay,
that.
you must be cousins then.
Yeah. Okay, Dr. Akinrogunde, so let's get straight to it. Now, from a human angle, professional negligence cannot be avoided. Now, however, in the medical field, the fallout is likely to be fatal or at the very least, life-changing. Now, tell us in broad terms, what's the trademark of medical negligence?
Thank you for that question. The truth is, it will be proper to start from the proper definition of what is medical negligence. And this is generally described as the heart, or the omission by a medical practitioner,
Okay.
which has been seen to cause an injury or sometimes the extreme death, to a patient in what is not expected for standard of care. In other words, what it means is that in the first instance, medical negligence can only occur if there is an expected duty to be performed by the doctor to a patient.
Okay.
And in the course of that performance of that duty, when you compare what is expected based on the level of education, the average skill in that context, that there being an act or an omission. In other words, if you don't do what is expected in that circumstances for your level of practice, it is taken that that a negligence has occurred, especially if this leads to injury or death of that patient. And of course, this can go in all ramification on where is the negligence starting from. It will be on the basis of the starting point itself, which is one, that was a proper diagnosis was not made in the context of what you have on ground. Of course, then in the course of having that diagnosis, the proper care was not seen to have been carried out. So if the victim feels so aggrieved, you can make a claim for a medical negligence.
Okay, we'll come to claims later, doctor.
All right.
And let me just dive in. Sorry, I'm sorry the way I even I did that. But you see, there's a very thin line between omission and commission. But whichever way it is, we still look at human error, okay? So while human error can be blamed on negligence, some incidents are purely inexcusable. Would you please walk us through some of the scenarios of maybe outright negligence so we have a proper defined line?
Yeah, well, like I said, uh, your expectation could be both objective and subjective. Objective because of the fact that this is what you think should have occurred. But the reality of the situation might not make that expectation to be possible. How do I? There's no doubt that in the system where we operate in this part of the world, things are not working as expected. You imagine a situation whereby you brought in a patient. This patient required an immediate surgical intervention. Yes, the surgical teams are on ground. I'm taking a typical scenario of what can happen,
Yes.
say, in the public hospital now. And suddenly, there was power failure. In the course of that, something has happened, the director cannot come up. Now, from the person who is watching from outside, he thinks the doctors or the health practitioners are negligent. But the reality is that the system sometimes make it very difficult, for the people who intend to perform at optimal. We face this every day. And so when you look at the medical negligence side, you also talk about the system, which is also negligent primarily. And that is probably what everybody is leaning on. I hope I'm clear now.
Yes, thank you. Thank you, doctor, because actually, what you've answered that question in such a way that it pacifies us to a large extent, because we want to know exactly where to put the blame.
For me, it's not about putting the blame. I don't even think it's a blame game, really. For me, it doesn't want to pacify. I feel like, Dr. Goke, I just feel like, okay, so you've talked about which are factors we all live with in Nigeria. So while this operation is going on, power can go out and all of that. But for most of the medical cases, the negligence that we've had, it hasn't been, most of the reported cases hasn't been because of power outage. They have been because of the carelessness of the medical personnel. So I would like you to just speak a bit of that, because the truth is, no matter the level of professionalism, mistakes do happen. We also know that doctors simply cannot play God. So do we bring in the will of God to medical mishaps?
No. That would be clouding the issue by saying this happened is the will of God. The reality is that, what I wanted to stress the other time is that, notwithstanding the fact that we have these challenges, some things cannot be excused at the level of the individual performing the duty. But in general terms, the truth is that we need to have a sense of balance. The Nigerian Medical Association is very pragmatic in the context of the fact that, in spite of the challenges that we face as doctors, as healthcare practitioners, we need to be on our toes, and we need to, as much as possible, be seen to be performing our duty to the best of our ability in tandem with international best practices. And that's why, for example, the Lagos State, the Nigerian Medical Association Lagos Zone, deem it fit to have this committee stand in on medical negligence, which is primarily is supposed to serve two purposes. One is to continue to remind our colleagues that you cannot be seen to be negligent. We are powerfully involved with making sure that we continue to drum what we have in the medical ethics, what we have, in our code of professional conduct, that this is continually, brought to the fore, because, like you said, it's not just matter of mistakes. Sometimes you tried all things possible, and yet the resultant effect is not expected. But you must be seen to have done all that is right in that circumstances.
Yes, Dr. Goke. Thank you. I'm so happy you talked about international best practices, and you also talked about, the mode of the ethics. Now, all of this, ethics and whatever, doesn't take away the uncontrollable factors, which we talked about: power failure, system malfunction, and all of that. Now, yes, you've been protecting the side of the practitioners. How do you now help them? What kind of intervention have you proposed, or are you forcing the government to put in place to make sure that at least medical facilities and all of that are not devoid of power
the basic
supply
needs, yeah.
and these hitherto uncontrollable factors?
Of course, there is no doubt that we are in a challenging environment. The environment is not friendly, and that is why for often, time, you have a situation whereby you see doctors who are forced to embark on campaigns, sometimes this leads to strike action. In build with those demands, it's not just a question of appropriate nomination. In most cases, it's also a question of how best can we care for our patients. The question of making infrastructures, to be prominent features in these our demands. And we must say that to some extent, we've seen results, in this context. Of course, unfortunately, in some instances, patient do suffers, So generally the situation is still not at the point that you will say we are there yet. We are still very, very far from there, and especially in a system whereby every now and then, what seems to be primary is a question of how do we save costs? How do you make profits? I'm talking about especially in the general balance of the Nigerian health system. So if you continue to have a situation whereby you have less than 5% of the national budget, going to the health sector, invariably, it will come down to the fact that the infrastructures that we have on ground will suffer, and not only the infrastructures that is the one that is supposed to put on ground, even the ones that you need to put on the maintenance, proper maintenance, also suffers. So you have all this going on. I will also concede too that there are instances whereby this situation gets, on the nerves of the people that are supposed to carry out, some of these duties. I mean, when you are just frustrated that things are not working the way it's supposed to work, apart from the fact that your take-home pay cannot take you home, even to do your duty the way you want it to be done, it's a problem. And that explains the reason why you have, exodus of Nigerian doctors and other, practitioners in Nigeria, leaving the shore of the country, for, the climes where things seems to be working. So those are the challenges that we have. We continue to push, and we continue to educate our members and also the public in general. For example, the recent case of Oju Oboma that you mentioned, I've seen the Nigerian Medical Association, coming out to even enlighten the public on the fact that the law is not productive. I mean, it's not protective of perceived, negligence, the law make provisions that you can seek redress at the highest level, of our professional bearing. We have the Nigerian Medical and Dental, Council of Nigeria, who has the disciplinary tribunal and an investigating panel too, which people can seek redress. If you think a particular, practitioner has not done what you think is right, you have the right. It is encoded in the law, and how to go by it is very clear. And people that venture into that, on both sides, you have a test of situation, in the sense that you might think that there may be negligence on the basis of what comes between the tribunal, looking at the situation of what is really on ground, what is the capacity of the system and the practitioner. Oh, this doctor has hair. Appropriate sanctions, could be given. But in other instances whereby things are seen in a very objective balance of facts, and reality. There are cases whereby the practitioners, was able to prove his case that I tried all I can. Unfortunately, it results in this passive negligence, and the person comes out of the loop. So, in the way it is now, you can actually seek redress, at the proper channel.
Okay.
Which is the,
I need to interrupt you, Dr. Akinrogunde. So, since you are the chairman of the committee for negligence, the Lagos chapter, I wanted to find out from you how many cases have been successful. So, yes, you tell us that people can go and seek legal redress, but can you give us like number or statistics so far, at least in your tenure, how many cases have been successful that people have tried to seek redress and they actually got, they got justice?
Yeah.
The truth is that our own committee is not a committee of trial.
Okay.
It's a committee, that the primary duty is to bring to the fore that medical negligence is a reality and is something to be prevented.
Okay, great. But I just wanted to find out, are there cases where people have actually got to justice?
Yes, there are, but where you get justice is where the status says you go to, which is the courts of the medical, practitioners, what is called the Medical and Dental Practitioner Disciplinary Tribunal, and who has the first court of first instance is the investigative panel. Now people go there, you find out the details, how you channel your complaints. Usually it comes by way of affidavit, which makes it legally tenable. You file your complaint, and people are getting. So when the panel sits, we've had a situation whereby even lately a colleague was indicted at the University of Benin Teaching Hospital. A professor, and necessary sanctions were applied. And this happens by and large. Just that, in our society, and to some extent, the fact that the core media does not follow events from beginning to the end. As a matter of fact, the disciplinary tribunal is really overwhelmed, with complaints. So it's not a question of trying to count the number of cases at the tip of your finger. There are numerous cases, that when the tribunal comes to sit,
yes,
how that happening.
But you said something very profound. You said the core media did not follow up, because I was beginning to feel that maybe we have a communication issue, that maybe we're not putting it out there enough for people to start feeling or getting the getting more of the results. And probably there's still a bit more to be done in that regard. But let's just even put that aside for now. Doctor, if we agree that negligence is a kind of by definition is a breach of legal duty to take care of a situation, would it be right to assume that medical negligence is deliberate?
Well, you will have realized that in the course of my contribution, perceived, of course, it can't be deliberate on the part of the practitioner. Okay. Now, are you hearing me?
Yeah, please go
Okay,
ahead.
go ahead.
Go ahead.
Okay. Now, it can't be deliberate. The kind of ordinary. Let me put it that way. It's not expected to be a deliberate act. If the practitioner is seen to have done something deliberate that is coming to term to be called medical negligence, and it's quite, the penalties are well laid down, in the acts that establish the Medical and Dental Council of Nigeria. It starts from the fact that you can suspend a particular practitioner from as little as 6 months to the fact that you can struck out the name of that practitioner from the register of the council. So that person is not qualified to practice in Nigeria, and that can also be taken beyond the shore of Nigeria, if that should happen. So nobody will deliberately commit acts, that is known to be negligence, because there are two things that comes to have. One thing that a doctor is trained primarily is to preserve life. Yes, and that must be seen to be done at all instances, even to the point that if you are a medical practitioner in the military, the necessary conventions, in military annotations that are of relevance, even protect the lives of the enemy, that you don't have a right to willfully take the life of that person as a doctor. Whether the person becomes your patient, it's your primary care to make sure the life is preserved. Yeah. And I think in the main, for majority of us, that's how we look at it. Most doctors exist in their practice to make sure that we maintain the sanctity of life. Well, just like I will not hold it for everybody. That there could be instances whereby people with practice their trade in such a way that it puts the whole essence of our practice in dispute. But in general, in the main, our colleagues are still there trying to make the best out of and all situations that we have on that is below par to what is expected.
Yeah, thank you.
So we just continue to appeal to the public to understand the situation that it is, and that if there are cases of passive negligence,
okay,
you have a right
to report where. Where do we go and report if there's medical negligence?
The law says that you report at the Medical and Dental Council. Okay. And when that happens, immediately the investigation panel usually sets the ball rolling. Okay. I'm sure that some of these cases that were being mentioned, already there are the process is already on ground. If you make that report, and this is unmindful of the fact that the case may not even be what you are aware of in social media, where you have a lot of emotion comes in. Even there are cases that you don't have, you just get to know that somebody is being punished because of what has happened in the past. And don't forget, the Medical and Dental Council Disciplinary Tribunal is at par with the High Court in Nigeria by law. So it's a very serious issue. Okay. If your case gets to that place, you can only get a redress if it goes contrary to expectation of the practitioner at the High Court. And even at that instance too, the law also made provisions that if the practitioner negligence, the civil aspect of negligence is sorted out at the level of the tribunal, you can claim some other things, including damages for malpractices. These are the things that the law provides for, and we are just hoping that there will not be a basis for individuals to say, I want to seek redress, because of medical negligence situation. But we know things still come the way you don't want it to be sometimes, and it goes that way. So you have the right, and it's we don't shield that aspect of our knowledge. You have the right.
Of course, it will always exist. We'll always have mishaps, accidents, and all of that. And of course, the victims on the other side will feel, will feel bitter about it and want to seek redress. So it will never go away. It's going to be, it's going to remain an ongoing,
memorial case.
Yes. So, Doctor, thank you very much. But before we let you go, I want to paint a scenario. I remember that last year, during the COVID, in the height of the COVID pandemic, I lost someone who was, I think she was diabetic or so, and she moved from one hospital to another, maybe about 3 hospitals, before eventually getting to one of the federal health institutions where she finally died.
Wow.
She did not die of COVID.
Okay.
She died because those hospitals
refused to attend to her,
just to address her issue of a spike
because of the fear of COVID and all of that.
Yes. So, on whose laps? Yes, it's not a blame game, but on whose laps would we put such a blame? Who do we go to, for instance, if we wanted to seek redress? Is it all of the 3 hospitals, or all 4 hospitals, or what?
Well, it's not only you. I will have some personal confession here. This time last year, cases like that were actually on the rampant, and that is understandable to the extent that you have a pandemic on ground that is a new pandemic that even in the best of the practices, nobody understands what it's going to be the outcome. So you have different protocols that were put in place by the health authorities, not only to protect the health practitioners, but also to protect the health system in a way that it does not get overwhelmed. So when you have a situation whereby you have a patient that has comorbidities like diabetes, like hypertension and things like that, and what we know about the pandemic then, that up to now, is that those individuals have higher risk, than the general population. And at the same time, too, you want to make sure that you want to protect people inside too. So you have that problem at that period. Not even doctors and nurses also fell, victim, of that particular, which is of that particular situation, which is due to the fact that you don't, the fear of the unknown. There are so many of such cases. Looking back, we all agree that, we could have done better. I mean, that is the truth. When you look at, we did this time because we want to prevent people from catching, COVID. But at the same time, during that period, we actually lost more people to other health, conditions that are not directly COVID than even to COVID in this part of the world. So there are so many things that we need to sit down and, at this instance, we are all having a reflection on the fact that we could have done this better than the way it was done. And on a personal note, some of us actually felt very strongly on some of those approaches that we find ourselves at that point in time. I remember that yours truly actually did an article on a particular patient that
Didn't
had,
need to die.
had cancer, and unfortunately, because of the fact that the hospital, especially public hospital, has really trimmed down the amount of patients that can, that are supposed to be in the in-house, and also even make sure. I mean, at that point in time, we also trim the amount of practitioners that will be on ground so as to avoid the crowds at any point in time. So the patient died, and I think I raised my own opinion on the fact that we could do this better than the way it is.
Yeah.
So it's an unfortunate situation. We learn, and on behalf of the community, I would like to say that we empathize with that situation for you. Sorry about that.
Thank you.
Sorry. Well, sadly, the life has been lost. So I just wanted to, before I let you go, I have to ask this question about, gunshot wounds. And I'm asking this also because I have experienced this personally. A few years ago, I was shot on Western Avenue. I couldn't go straight to the hospital. I had to go first to, I think, the Alaka police station to literally beg and drag a policeman to take me, to follow me to the hospital so that I could get, treatment and everything. So now, when a medical facility fails to take the case of a gunshot wound victim and the victim dies, do we consider that medical negligence? Who do we blame? Is it this peculiar role of bureaucracy existing in our police stations? Is it the medical? So just tell us, who do we blame for this? Because, I was a victim. I couldn't even start because at the police station they were telling me to write statements and everything. And there I was, with blood all over me. And then the driver who was taking me also, was shot. There was no way I was going to write any statement or remember the plate number of the car that was stolen or anything. And then, thankfully, I survived. And right after they brought me in, because it was just a robbery down the entire Western Avenue at that time, a policeman was brought in. Some other people were brought in. Some people made it, some people did not. So how this age-old question of treating gunshot victims, please just give us like a word or like a final note on this.
Well, I think the final note is clear now, unlike before, where you have different of ambiguity of when to intervene treating gunshots. Now, gunshot injury is taken as a general emergency.
Okay.
We've had interaction with the police, and there is even a law that says that such emergencies are the ones that you should attend to, even at the private health facility level, even when the question of money does not come in. There is a fund that's supposed to be pooled, administered by the NHIS, that is supposed to sort out that. But as it is, there's no excuse not to treat gunshots. The idea is that you treat and you report. I mean, things are much better than the way it used to be decades ago, whereby it can take ages for you to formally report such things. The thing is to make the police aware that this has occurred, but that should not prevent the treatment. I will treat, even at the other extreme period, knowing that if you don't treat, a life is at stake, and that is what is primary. The whole essence of medical training is to maintain the sanctity of life.
Okay.
To maintain the sanctity of life. And quite frankly, that is, I think, the most convenient spot.
Yes,
for us
to end this conversation.
To wrap up the conversation for today,
Yeah.
and also to thank Dr. Goke Akinrogunde. Yeah, we got it this time. For joining us. We have really learned a lot from your contributions today. So thank you very much.
Thank you, sir, and well done with the good job you're doing so far.
Thank you.
Despite the Nigerian condition.
And you continue to push it.
Yes.
You enjoy the public to also understand this situation that we find ourselves.
Yes. Yes, no problem.
Those of us that choose to remain, we should not let us run away.
All of us cannot leave the country. So on that note, thank you very much. Thank you very much again. So we're going to take a short break, and when we're on this break, we're going to have the fitness segment with Dolakwa. But right after the fitness segment, Farah Wotomo is going to be talking about the realities of childbirth. the realities of childbirth. And she has an interesting guest. You don't, want to miss it. So stay with us. We'll be back shortly.